Unima Education Development and Therapy Commission. My name is Livia Kroflin. I'm the current president of the commission. And as you all probably know, the webinar series bears the title, What a Puppet Can Do, Applied Puppetry in Theory and Practice. The webinars will be held once every 2 months. They will be recorded, as you have just heard. So that was all I wanted to say. Now, ladies and gentlemen, I give you Cariad Astles.
Thank you very much, Livia. Thank you very much for inviting me to do this webinar. And also thank you very much, Emmanuel Castan from Unima for setting up the Zoom link for people to join. And also thank you to you all for coming. I'm very honored. I was sent the participants list just before this webinar, and there are a number of you amongst the participants that I know or have, encountered along the way. And I just want to say I'm really honored that you've come along to listen to me talking about puppets in hospitals today. I'm going to share a PowerPoint and I'm going to show a couple of videos as we go through. I hope you will be able to hear the videos. We tested a little bit earlier and we think you should be able to hear them if I have my volume up. But as you know, technology and Zoom links can always be a bit complicated. I'm going to leave 10 to 15 minutes at the end of the webinar for any questions, because I think it's important that we've got the chance to discuss some of the things that come up in these webinars. I'm going to start with a bit of an anecdote. And I'm going to talk a little bit about puppets in healing before I go into talking about puppets in hospitals specifically. I don't pretend to be an expert, and I'm sure that many of you here today are as much or more expert and experienced in working in these contexts as I am. But I just want to give some examples really today, talk to you about why I became interested in it, some of the projects I've done, some of the projects that other people have done. I'm going to give you some examples and some case studies. Think about some of the qualities that puppets have, which make them, in my opinion, really fantastic things for working in hospitals across a whole diversity of people in hospitals. And then I'm going to think a little bit towards the end of the webinar about what's still needed. What do we think is still needed? And I'm really open and welcome to your suggestions. I want to tell you also that this topic of puppets in healing, more broadly than puppets in hospitals, but specifically puppets in hospitals, is something that I am completely fascinated by and increasingly fascinated. And I'll tell you my anecdote in a moment, but I also want to tell you a little bit of my own kind of academic / practitioner journey. Those of you who know me know that I'm both an academic and a practitioner. And my research journey, which is related to my practice, has gone a sort of roundabout route, I suppose, to finding this very strong interest in puppets in healing. I started out being very interested in puppets in national identity, how puppets were used to represent cultures and identities and so on. And then moved into thinking about, talking about the needs in puppetry training and what happens to the body of the puppeteer and of the recipient when they're involved in puppetry training, the relationship between the puppeteer and the puppet. And through this route, that led me into the phenomenological experience of doing puppetry and receiving puppetry, and how important that was for expressions of self. Expressions of identity, expressions of self, and in creating narratives of self. I use the word narrative advisedly because I think in medicine, narrative is hugely important in the way we understand what's happening to us, how we are positioned within that journey. And there's a whole sort of practice and theory of narrative medicine, which is relatively recent, which places the patient at the center of their own story, their own narrative story of health, illness, and so on, which I think is really important in puppetry. So that's a little bit about my research journey. I work at both Exeter University and the Royal Central School of Speech and Drama as puppetry tutor. And in both of those institutions, we've had an ongoing practice in hospitals. This has developed over a number of years. We've worked with St. George's Hospital in Tooting in London in the paediatric ward over several years. And we've also worked in 2 hospitals plus a hospital school in Devon, which is the county where I'm based. We've worked in Exeter Hospital, we've worked in Torbay Hospital, and we've worked in Exeter Hospital School as well. These, again, have mostly been in paediatric wards, but we have done projects in Torbay Hospital, also in the dementia ward and in the stroke ward. So I'm going to talk briefly about those projects a little bit later. So that's by way of an introduction. I think I'm going to share my screen now. So hopefully you will be able to see that. Okay. Sorry, my computer seems to be a little bit slow. Right, so I'm going to now tell you my anecdote. This is a very personal anecdote, and it's about my son. When my son was only aged 1 year and 3 months, he had a very serious accident in somebody's house where he drank some acid. This meant that he couldn't swallow. His whole esophagus was burnt and he wasn't able to eat and he wasn't able to drink. He then was fitted with a tube directly into his tummy, and we were in hospital all the time with him. He was treated in the most sort of important children's hospital in the UK, which is called Great Ormond Street Hospital, and we were in and out for many years. One time when we were in there, he came across a doll slash puppet which had a tube into its tummy. He'd never seen that before, and I'd never seen that before. And he was fascinated with it. And he picked up this doll and he held onto it so tightly. And he kept on and on looking at it and looking at the tube into its tummy and looking at his own tube into his tummy. And for me, he wouldn't let go of it during the whole hospital visit, and he looked for it on subsequent hospital visits. And this had a very sort of profound effect on me, really, in that I saw in him picking up and holding on to this doll slash puppet with a tube into its tummy, that he was finding some kind of validation and acknowledgement of his own condition. Because, of course, he was in a world surrounded by people who were eating through and drinking through their mouths. And suddenly there was this object that was there that was the same as him. So this possibly affected my interest in puppetry in hospitals. It's hard to say, but I just wanted to share that anecdote with you because it was very, very, very powerful for me to see him relating to this other being which was like him. So Um, I'm going to talk a little bit now about puppets and healing. My own, oh, sorry, my computer is very slow. My own research and my own interest in puppetry is about this mediator role that the puppet plays in between worlds. We do know that puppets, in their original forms or in the earliest records that we've got of puppets, were in funeral rituals. And puppets we know to be mediators between different worlds, different states. And that is, in my opinion, their place, is that they inhabit this place between life as we know it and another place. And of course, being in hospital is very much an in-between place. It's a place we think of normal life, if you like, and hospital as something that is not normal life, even though most of us will at some point in our lives probably spend some time in hospital. But it's also a kind of in-between place in hospital, which can be seen to be between wellness and illness. It's that place where you are for some time, where to some extent your fate is decided. So I think puppets have a very, very powerful intrinsic role in helping people navigate those difficult in-between places, those threshold experiences, as I will call them. And there's lots of fascinating research being done into the uses of healing objects in contemporary medicine. That includes not only puppets, but also the use of animals, for example, the use of writing and narrative that I mentioned earlier, and also the use of placebos. Placebos are now not being considered a deceptive trick used by doctors to prove the power of real medicine. But the placebo, like the puppet, like an animal, is being considered a possible useful medical approach which activates the power of the mind and the soul in a very holistic way to enable healing. So puppets, I would say, occupy a similar space to this. They're used to recognize and to reimagine the fractured self and to enable key psychological healing processes to occur. In Western medicine and in Western puppetry, to a large extent, we have become accustomed to the secular use of the puppet and in some way the mechanistic use of the puppet. In medicine, the puppet and the arts in general might have been seen as a pleasant but unnecessary addition to healing. But contemporary beliefs relating to healing, well-being, and holistic medicine are now placing the value of the self, the psyche, and additional healing aids as much more important than previously. Now, I'm just going to mention a bit more about narrative medicine. This is an idea developed by Rita Sharon from Columbia University in the US, which places the patient at the center of the medical encounter and is based on these 6 principles: intersubjectivity, relationality, personhood and embodiment, action towards justice, and creativity. And I suggest that puppetry is right at the center of all of those things. It is an interrelational, intersubjective activity. So I'm just going to give a couple of examples of puppets in healing. For example, around the world in historical and contemporary contexts. So in Indonesia, there are puppets called tau-tau puppets, which have been used and are still used to perform during funerals and sometimes after the death of the person to show that life exists after death. Similarly, In Nepal, there are puppets that you can see here, tamaka puppets, which are danced in the street during a festival, a particular festival, the cow festival, but it's that they're danced to represent people who have died at the first cow festival, which takes place after that person has died. And it's another way of recollecting that that person still exists, but they're just in another world. In Benin, there is this fascinating tradition of Gelede puppets, which are related. One form, there are many forms of Gelede puppets, but one form is related to twins when twins are born. And if one twin dies, puppets of the twins are danced to represent the ongoing relationship between those twins. Now, this example from Taiwan, I just think is fantastic. It still happens today. It's based on the historical view of the puppet as healer. It's a tradition whereby when somebody is ill or when somebody's had an accident in some way, perhaps a car accident, I heard about it in the context of a car accident, a puppeteer is sent to the place of the accident. And they dance their puppet, which is a marionette, in the street. The idea of this, as I understand, is to gather together the fragments of the soul that have been scattered in the accident. And then they go to the hospital. Or if it wasn't an accident, maybe they just go to the hospital. And again, they perform a dance. The marionette performs a dance. And the idea of this is to bring together those parts of the fractured soul and fractured psyche. So and also, I think this is the last example, in Burkina Faso, sometimes puppeteers go along with healers to diagnose conditions. So they're used as a sort of form of diagnosis in medical care. So, okay, let us move on then. Let us move on to talking about puppets in hospitals. I want to emphasize that there are many, many forms of puppetry in medical settings, but I'm now just talking about puppets in hospital treatment centres. So, puppets have probably been used in hospitals for centuries in one way or another. But documented research and documentation about activities is very scarce from before the 1950s. We have got examples of puppets in hospitals in the 1950s and the 1960s, which we know was a period of huge social change. The arts were valued in an applied context in a way that wasn't necessarily recognized before. But to some extent, especially during the immediate post-war period, say 30 to 40 years, puppets became associated much more with children. The global concept of childhood as a concept arose during the 1800s. But with the rise in use of television and cinema as a mode of entertainment and news reporting for adults, puppets became much more used for children. So a lot of puppetry in hospitals was used in pediatric wards. These puppets were used largely by nurses in pediatric care who wished to alleviate distress and anxiety. And they're still used in that way, of course, today, because this is a key thing in working in hospitals, is diminishing anxiety, diminishing trauma. However, in Argentina, during the early 1960s, there was a very significant study of puppetry being developed by Jaime Rojas Bermudez, an Argentinian psychologist who worked with patients in the Borda Hospital in Buenos Aires, alongside the well-known puppeteer Ariel Bufano, to use puppets to engage with adults in a locked-in state or in states of severe mental illness. this project was hugely important for the use of puppets with adults in hospital and has had massive repercussions for the development of puppetry with people with mental illness. What I find fascinating about this study, which has subsequently led to many, many other studies, is that Rojas Bermudez categorized the human face as being dangerous in many ways for people with severe trauma, severe mental illness, severe mental conditions. The human face is very, very mobile. It's always moving. It can be confusing. It's not always transparent. Whereas the puppet face, it might move. We all know puppets can have moving mouths, but it's a more fixed expression in some way. And so Rojas Bermudez developed the idea that puppets were safer. They were safer because they could be interpreted more easily and more quickly. And of course, also because they could, people could project onto the puppets. They could project their own ideas, their own personalities, and so on. So this has, as I said, been massively influential in all sorts of psychoanalytical and psychological circles. And puppets are recognized as a method of therapy for people with mental illness. So that's very interesting because it's one of the few very well documented uses of puppetry in hospitals with adults as opposed to with children. So there's also reports in Canada and the USA of puppets being used with children during the 50s. And it's worth noting also, I think, that the use of puppets and the other art forms in general in hospital settings varies enormously according to different countries' politics and policies about the uses of the arts in medicine and applied processes in general. Again, I want to flag up that Argentina, Brazil, and the USA to some extent were real pioneers in the use of puppets with adults in hospitals, whereas perhaps in Europe and Africa, and to an extent in Asia also, the educational use of the puppet in hospital settings has been perhaps more important. But the 21st century is now opening up so many studies in the use of puppets in hospitals. Puppets have been used by nurses and play therapists and other medics, often without any particular training, as a means to entertain and distract children. But now there is a much more focused examination of training needs, different uses of puppets, and important contexts. So I'm going to move on now to talk about the different ways in which puppets are used in hospitals. Puppets are used as a means to distract and to entertain, as I've mentioned, especially for children. Perhaps this is one of the best known forms of puppetry in hospitals. They offer entertainment, they offer light-hearted fun for children suffering from traumatic conditions, pain, fatigue, and all of the difficult, intrusive procedures that you find in hospital. And there's a whole kind of, I hesitate to use the word industry, but there's a whole kind of practice around puppets being used in hospitals for this purpose. And I just want to share a quick video with you. So just give me 1 second while I move from the PowerPoint to the video. Thank you. Okay, these are puppets run by a company called Patient Puppets based in Canada. And it's these are puppets which are used to educate about hospitals and about different procedures. So hopefully you'll be able to see this. I will turn up the sound as much as I can, and let's play it.
Would you like to wear a lab coat, Nurse Aiden?
Dawn Kidder and Lizzie work with children like Aiden Bourgeot daily at Children's Hospital. As a child life specialist, she uses patient puppets to engage kids in medical play, which helps them learn to cope by acting out stories of illness and recovery.
Lizzie has cancer, and so she has the things that children with cancer are familiar with.
Aiden was diagnosed with leukemia 2 years ago.
They're a fun thing to work with if you're learning something new about like what happens when you have cancer.
The puppets are designed to demonstrate to children specific medical procedures affecting them and help minimize the scary and painful part of being in hospital.
They're less threatening for children, and children feel comfortable. There's a lot of playfulness and purpose and practice and rehearsal, and children start to acquire a sense of mastery and a deeper understanding of what is really going on with them. Mom, I love you.
Kidder says puppets like Lizzie, which are made and designed in Winnipeg, are also a medium to teach children and promote understanding and acceptance of differences amongst themselves, with procedures that range from cancer to limb amputations.
This puppet and all of us collaboratively play a huge role in helping children acquire some effective coping with amputations and other things that might happen to them.
Aiden thinks the puppets are a great idea.
When they do the treatment, they do it very carefully and ask what you want to do when the procedure is going on. Like if you want 1, 2, 3, or just do it, they always ask. There you go.
Perfect.
And even after 28 years in the child life department, perfect is how Kidder describes her role at the hospital.
Because it's that satisfying to have the privilege of working with these families when they're going through something very challenging. I'm going home now.
Bye.
Bye.
Gord LeClaire, CTV News.
Okay, I'm going to stop sharing that video, and I'm going to move on to the next quality or purpose, if you like, of puppets in hospitals, which, you know, they all interlink. It's not like one doesn't affect the others, but puppets are used as a very good means to articulate and to explore children's feelings. Now, there's a wonderful puppeteer in the US whose name is Susan Lin. If you've heard me talk before, you may have seen this video before, because I think she's simply terrific. She works in Boston Children's Hospital. And I'm now going to show you a little bit, just a very, very short clip of Susan Lin talking about coronavirus with her puppet. Get along a bit.
Would like to go to their house, but you can't. But I want to. I know you want to. But they want me to. I know they would like you to come, but you can't go to their house. But why not? Don't you like them? I love them. That's not why you can't go. Well, why can't I go? I think you know why. It's because of Corona, isn't it? Coronavirus. Who is coronavirus anyway? And why won't he let me come go play with us in my life?
Okay, I'm just going to stop there because I'm aware of the time, and there's quite a few other examples that I would like to talk about. So, puppets for entertainment, puppets for teaching, especially children, about different medical procedures. Now, I want to, as I'm going through, I want to flag up some of the very important case studies in this practice. And I just want to flag up, I've mentioned Susan Lynn just now. I want to flag up the very, very important work done by Persephone Sextu, who can be seen in here in this picture, who started a project called CAD Lab in Birmingham of taking theatre into hospitals in Birmingham, and she's worked extensively in other places as well, and in using puppets to tell stories to the children. And she's done a lot of research which shows very clearly that the development of confidence in the children, the development of autonomy, and the development of understanding their conditions in hospital has been really influential in how they navigate and how they negotiate their care. And Persephone was very influential also for me when I was starting out my work in hospitals, in understanding the importance of the bedside story. The bedside story is an individual story that is done for an individual child. And I think, you know, not all children in hospital have to be in bed, but many of them do, and many of them are very fatigued. So to be able to take a bedside story to a child and to engage them in something which takes them out of their everyday environment and onto an imaginative journey is a very important use of puppetry in hospitals. And I will talk a little bit more shortly about my own project on healing stories. There are some different approaches, and I think I'll just say now that one of the there are some practitioners in hospitals who think that the most important thing is to distract and entertain and not talk about the illness. And there are some practitioners who think that it's worth talking about the illness itself in some form through the puppet, whether that is directly or symbolically. And that will lead me on to discussion of symbolic healing stories shortly. And I'll come back to talk about the Helium project also. So there's also a fledgling movement of doctor puppets in hospitals for the same purpose as clown doctors, really, to make doctors less scary, to take doctors around wards to talk to children in paediatric wards. To enable them to feel less scared of doctors when they come along in their white coats with all of their implements and their equipment, and they want to invade the body. So the doctor puppet can be an approachable or friendly or silly figure and can demystify the doctor figure. I've been talking to somebody recently about setting up training for doctor puppets in the same way that clown doctors in hospitals now have sort of official training. These are examples of sort of suitcase theatre. Now, I've been working in Exeter Hospital, not with these two particular scenes here, but I have been using suitcase theatre as bedside stories, which are healing stories. A healing story is usually a symbolic story which takes the patient through a series of encounters, a little bit in some way like the hero's journey, where they overcome obstacles, which enables them to feel empowered, this is the theory, towards the end of the story. With students in Exeter University, we've been offering children in at their bedside choices of different stories that they can choose to be told or to interact with. And these are all suitcase stories, and in those stories there are symbolic obstacles to overcome, and students have also been writing healing stories. It's a really interesting process, and I would be very interested to hear other people's thoughts about whether we need to address the illness in whatever form, or whether we need just to distract. So the next use, very, very important use of puppets in medical contexts, is to train medical staff. So nurses, doctors, and other caregivers in hospitals are being trained in different places by using puppets. These are some images of work that I've been doing. The medics might learn to use puppets in order to distract or to educate, as we've talked about before. But training is also used by medics involved in handling of puppets to develop greater sensitivity and responsivity towards other bodies. And I call this slide diverse bodies. In several countries, not all, medical staff are now obliged to undertake study in the arts and humanities alongside their medical training so that they develop their communication skills and empathy. Puppets are often used in this training to help doctors to view patients as individuals and also to respect and honour diverse anatomies and diverse conditions. And I do a project with doctors called Alternative Anatomies, in which we use all kinds of objects and materials to make puppets that have very, very different kinds of anatomies, not the normative sort of 2 arms, 1 head, 1 body, 2 legs, etc. It's very exciting. They are very inspired by this. But one of the problems of this is that these projects are often led by individuals. So there's very little sort of widespread institutional training for this. And this is one of the issues, I think, that comes up when talking about developing puppetry in hospitals. And I also really want to flag up the fantastic work also done at the University of Ulster by Matthew Jennings and Carl Tizard-Kleister, who've been also using puppets in training with emergency response staff and trainee nurses, assisted by a puppeteer called Karen Torley, for the same purposes, really, to develop empathy, to develop sensitivity towards different bodies. So that's another very, very, very important use. Oh, these are, this is examples of how puppets can be used in healing stories. This puppet was created by somebody to explore the difficulties she had with dating history, and this puppet was used as in a show as a chance to explore loss of and subsequent sadness, loss of family and so on. So puppets are also used extensively in research, and there's a wonderful project that was set up between a puppeteer called Rachel Waugh and a terrifically named surgeon called Professor Kneebone. And I'm going to, if I've still got time, I think I have a few minutes, I'm going to play a little bit of a clip, a very, very short piece of a clip from a lecture that Rachel Waugh and Dr. Kneebone did together. So it's called The Myth of the Lonely Heroic Surgeon. This project was about exploring the synergy between surgery and puppetry, and how puppetry could be used as a means for surgeons to develop dexterity, because there's a lot of synergies between the way in which teams of puppeteers work and how they handle materials and so on. So let's just look at this for a second.
And so I'm going to stop talking now, and I'm going to invite you to think of what might come into view if we looked at the operating theatre from a different perspective altogether, from the perspective of other kinds of performance experts. And I'm going to introduce to you the idea of puppetry as an investigative lens through which we can look at the operating theatre and see things we might not have noticed before. So it's a great pleasure to introduce Rachel Waugh, who, amongst many other things, is the recently appointed puppeteer in residence at the Centre for Performance Science, which I mentioned earlier, with the Royal College of Music and Imperial. And I'm going to invite Rachel to come to the stage and first of all, just say a few words about who you are and what you do.
Thank you, Roger. Yes, of course. So I work as a puppetry director and a dramaturg, which means I help with the structuring of performance, and a puppeteer. And my background originally was in movement and dance and mask and mime, and then for a long time working with actors on new writing and developing sort of narrative and kind of character and so forth. And then some way in, I started working with puppeteers and puppets. And it was said to me fairly quickly from other puppeteers, if you're going to direct puppets, you should train to be a puppeteer, because you need to understand what the puppet can do, and you need to understand what it is you're asking of the puppet and the puppeteer. So I trained to be a puppeteer. And then during that, they said, if you're going to puppeteer, you need to learn how to make puppets. Because then you're understanding how joints work and how the different materials are moving or functioning and so forth. So I then did some...
I'm going to move on a little bit.
It's very different. But if you look beyond that and you look at the skills being used, it felt to me completely familiar. I could almost take the image of one and transpose it onto the image of the other. So specifically, the positions that the surgical team was standing in was almost identical to how my puppeteers were standing in a particular form of puppetry, which I'll talk about in a moment. And also the way they were using their hands, the kind of slant of their body, the focus, the gaze being essentially down, even though there is a kind of projected energy as well. The way that they needed to communicate, certainly with the focus being on the patient, or in our case, the puppet, it means that the communication is quite hampered.
And because of time, I'm going to stop that there, but it really is a fascinating project. And I believe that the team of surgeons is continuing to work with puppets as a means of actually making their surgical skills improved. I'm aware of the time. I'm going to sum up and then I'm going to finish with one more video, which I think is wonderful. So I'm just going to sum up. What do puppets do? What can puppets do in hospitals? Accompaniment. They can accompany people going through difficult processes, perhaps because the puppet is already an other and a person in hospital is kind of another as well. Puppets can assist with people who've experienced trauma. They can acknowledge either through the physicality of the puppet or in the way they interact with the person. They can support people who've experienced trauma. They can educate and they can demystify about medical procedures. They can help people develop empathy. So there's 4 primary purposes: to acknowledge, to bear testimony and accompany difficult transitional experiences, to educate and demystify, and to train and research. What is needed? Well, I think that clear planned training courses are needed for nurses, doctors, and medical caregivers. We also need more studies on the uses of puppetry in healthcare settings to develop the versatility and the variety. Should all paediatric children's wards have hospital doctors or ward puppets, for example? Should all hospital wards have healing stories? There are lots of ideas and there are lots of developments. I want to finish with 2 minutes of this wonderful video from a company called Theatre Rights, who collaborated with neurosurgeons at Great Ormond Street Hospital, the same hospital where my son was treated all those years ago, to look into how the brain works and how they then worked with children to encourage them to participate in understanding their own brain. So here we go. Okay, I'm going to stop there. And I'm going to now open for questions or comments. We started 5 minutes late, so I think we can have maybe 10 minutes of questions. So I can see that there are 3 comments in the chat. The anecdote is very moving. I guess that was my own personal anecdote. The full video of Rachel War. Yes, I can put these in the chat now. If I put the video of Rachel War in the chat, and also the link to the last one, the Animating the Brain project. Are there any questions? I can see Ava Loikona has put up their hand. Just give me 1 second. I'm just about to put one link in the chat. and then I will, oh, there you go. Right, that's the link of animating the brain, which hopefully you've seen. Ava, would you like to ask a question? Do we have to enable you to speak, or can you already speak? Ava or Charlotte, would you like to? I don't know if I need to give you permission to speak. By permission, what I mean is I'm not sure if the participants can automatically turn their microphones on. I probably need some help with that. Livia, do you know? If not, then put your questions in the chat and I will do my best to answer them. And Kapil Paharia, yes, there are people using puppetry and healing in hospitals in India. Let me put a link to an article that I read, which is really interesting. But Ava or Charlotte, would you perhaps, if we can't hear you, would you perhaps put in the chat? Meanwhile, I will put another couple of links into the chat as well. Okay, I'm just going to do the Rachel Moore one. I'm about to put in the link from about the chat is disabled. Oh, okay. Oh dear. Right. Okay. So I think I need help to know how to enable people to write in the chat. But some people have some people have.
Cariad, can you hear me?
Yeah, I can hear you. Yeah.
Okay. I wrote to Emmanuel, but I'm still waiting. I suppose she has to do something. Yeah, I can't see anything in the chat, but maybe you can answer in questions and answers.
I don't know what the questions are. That's the problem. We've got Charlotte and Ava who say their chat is disabled, but then we've got other people who are putting questions in. There are two questions that the three questions. Phil Simpson says, where can we access training in this field of puppetry? Do you run any short courses? The answer to that, Phil Simpson, is yes, sometimes. It's, as I was saying, that there's little sort of regular, formal, organized training, but I think we should talk about it, Livia, because I think there's a great deal of interest in this. So the answer to your question, Phil, is that mostly the training is done either by puppetry companies or by practitioners in a kind of ad hoc way. But I'm really interested in setting up some sort of ongoing training in applied puppetry in general that people can participate in. So I guess watch this space. How do you choose puppets? Daria Dubovich says, how do you choose puppets? I'm an artist in puppet theatre and I would really like to create puppets for therapy, but I care about if they are a bit weird. Well, there's a couple of things to say there, Daria. First of all, there's a huge thing in hospitals, of course, about infection control. So the first thing they will say to you is that you need wipe clean puppets. So you need to be able to move to build puppets and use puppets that can either be washed after every single use, or they can be wiped clean with disinfecting spray or something like that. And that actually really limits the materials you use. In the videos that I've shown, there are quite a lot of moving mouth puppets that are used very widely in hospitals. Myself, I tend not to use those. I tend to prefer puppets without moving mouths, but that's just personal preference. But I guess it depends on what the project is. We did a project in St. George's Hospital in Tooting, which was about children's self-image of themselves. And that was children who were in hospital for eating disorders. So they would draw a picture of themselves, and they would then create a puppet of themselves, and also a puppet of how they sort of dreamed they would like to be, and so on. And so it was led by the children. But I think the first thing to think about is what kind of puppets can you actually use in hospitals? And the business about them being wiped clean is really important. And the other thing that's really important working in hospitals is that your performances or your interactions need to be very short, 10 minutes. Because people are tired, and because there's people coming in all the time to take children or people off. Okay, thank you, Emmanuel. There's also a question about publications. So I haven't yet put in the chat the question about this article about puppetry in hospitals in India and about publications. But Ava, are you able to speak now?
Yes, can you hear me? Can you hear me?
Yes, I can hear you.
Okay, thank you so much for your wonderful presentation. My question relates to voice. You have talked a lot about the face expression and the movement involved. And my question is how, according to your experience, the voice through the puppet has an impact on the patient and in the relationship between the puppeteer or the doctor and the patient.
Are you asking about how the puppet's voice is important as a mediator between the patient and the doctor,
Right.
or the
Exactly.
puppet's voice in general?
No, as a mediator.
That's a very interesting question. To be perfectly honest, it's not something I've hugely thought about. I think when using puppets as mediators between the caregiver, I'm going to say caregiver because there might be a nurse or a doctor as well, and the patient, I have found that the puppet's role is kind of sometimes the puppet's role has been to make fun of the medic, to sort of bring them to the children's level. So I suppose in relation to the voice, I'm just thinking. This is new for me, and I'm really interested in it. I tend to restrict how much the puppets speak.
Mm-hmm.
Because I find that puppets that talk too much are actually a little bit like the human face. The words can dominate, whereas actually I want the figure to be more important, and the children or the people to be able to relate to the puppets a lot more. So I restrict the use of the voice quite a lot, and I also restrict words more than I restrict the voice itself. So I would use a puppet that might make sounds or would say a few words, but of course I'm also using puppets in storytelling and in relating to caregivers as well. So I would say that the voice is important in hospitals, that it's not too shrill, it's not too frightening, it's a warm voice, and it's a voice that perhaps the child already knows, so they've perhaps sort of had experience of that puppet already, and they know that the puppet is a friend. But I'm going to think about that a lot more, Ava.
Thank you so much.
Can I just quickly, I know Charlotte is next, but I'm just very quickly going to respond to Franz Hackemar's comment about the blind doctor Gibdel Wilson from Costa Rica, who I know quite well. And I usually mention him, Franz, but I didn't today. But yes, there is a wonderful blind doctor in Costa Rica who's an accident and emergency doctor who uses puppets in very profound and emotional situations where children are at risk of dying, and he uses the puppet as an accompaniment to talk to them and to tell them that they're not alone. And yes, Terence, there has been quite a bit of research on puppetry and dementia. Charlotte.
No, I'm fine. I was just trying to say that the chat's been disabled, but I've realised the links have ended up in Q&A, so that's absolutely fine. Thank you.
Okay, all right. Antje Wegener has said, for what the puppet can do in hospital, I would mention agency and ability they give. As a patient, I can do nothing. Doing puppetry, I am the ruler. Yes, I agree with that. Okay. Thank you for your participation. And I need to go because I'm doing the same presentation in French in 20 minutes. So I'm actually going to go. There were two questions I didn't have the chance to respond to. So what I will do now is I'll put my email address. I'm just answering that particular question about Gibdel Wilson. I'm going to put my email address. Where do I put it? Because I can only sort of answer the particular Q's and A's. Okay, this is the chat. So if you have a question, please email it to me and I will do my best to answer. I think Carol Sterling, please can you write to me? Can you see that email in the chat? I'm going to assume that you can. So once more, thank you, everybody. Thank you to Livia for this series of webinars, and thank you to Manuel for your support in this.
And thank you very much, Cariad.
Okay. Bye-bye.
Bye.
Bye. And the references will be put on the website.